One, in an adult learning environment, which instructional approach most effectively promotes understanding of the cardiovascular system's physiology through active engagement? A. Requiring learners to memorize all cardiac cycle phases in sequential order without visual aids. B. Facilitating peer led simulations that demonstrate blood flow through the heart using anatomical models. C. Assigning lengthy textbook readings on cardiac electrophysiology with minimal discussion. D. Delivering a continuous lecture on heart anatomy with no learner interaction. 2. When evaluating learners' understanding of the endocrine system, which assessment method most effectively aligns with adult learning principles? A. Administering a timed multiple choice test that only assesses rote memory of gland locations. B. Providing an open book case study requiring learners to analyze hormone regulation in a diabetic patient. C. Conducting oral questioning without allowing learners to explain their reasoning. D. Grading learners solely based on attendance and participation. 3. During curriculum development for a course on musculoskeletal anatomy, what strategy best integrates learner-centered instruction? A. Designing activities that encourage students to build muscle models using everyday materials. B. Requiring learners to copy skeletal diagrams without modification. C. Limiting instruction to instructor-led PowerPoint presentations. D. Focusing only on anatomical terminology without clinical relevance. 4. In anatomy instruction, which feedback approach best enhances learner retention and promotes mentoring? A. Offering immediate specific feedback on dissection performance during lab sessions. B. Providing general comments weeks after assessment completion. C. Avoiding feedback to encourage independent error correction. D. Limiting all feedback to written examination grades. 5. Which regulatory standard most directly affects the ethical teaching of anatomy using cadaveric material? A. Adherence to the Federal Anatomical Gift Act and institutional review protocols. B. Following informal instructor discretion for body handling. C. Using unverified sources for specimen acquisition. D. Omitting legal compliance due to educational intent. 6. When mentoring a student struggling with the physiology of the respiratory system, which strategy demonstrates effective communication? A. Encouraging the student to verbalize their understanding using respiratory flowcharts. B. Asking the student to read silently about lung volumes without discussion. C. Reprimanding the student for incorrect answers. Avoiding additional explanations to maintain class schedule. 7. To ensure compliance in teaching anatomy labs, which documentation practice supports accountability and safety? A. Recording detailed lab procedures and ensuring proper biohazard disposal logs. B. Allowing students to self-report attendance without verification. C. Storing chemicals without labeling to save time. D. Ignoring lab safety reports unless an incident occurs. 8. Which adult learning technique most effectively reinforces understanding of the nervous system? A. Problem-based learning using patient scenarios involving neurological disorders. B. Passive lecture on neuron types and synaptic transmission. C. Group memorization of cranial nerves without application. D. Watching videos without guided reflection. 9. When evaluating psychomotor skills in anatomy lab dissections, what method provides the most objective measure? A. Using a performance checklist with clearly defined criteria. B. Observing casually and grading based on overall impression. C. Allowing students to self-assess without instructor review. D. Assigning grades randomly to encourage competition. 10. Which mentoring approach enhances learner confidence in applying physiological concepts to clinical cases? A. Encouraging reflective discussions after case-based learning sessions. B. Criticizing students publicly to promote competition. C. Avoiding post-activity discussions to save time. D. Providing identical feedback to all learners regardless of need. 11. When developing curriculum for renal physiology, how can the instructor best ensure integration of evaluation and learning objectives? A. Aligning assessment questions with the stated renal filtration outcomes. B. Including unrelated topics to increase test difficulty. C. Designing assessments without clear objectives. Reusing outdated evaluation items. 12. In teaching the digestive system, how can communication strategies enhance comprehension? A. Using diagrams and analogies that relate to everyday experiences with digestion. B. Speaking in technical jargon without clarification. C. Minimizing interaction to keep the lecture concise. D. Using identical examples for all learners, regardless of experience. 13. In designing an online module for reproductive anatomy, which feature best supports adult learners' self-directed engagement. A. Interactive 3D anatomy simulations with embedded self-quizzes. B. Static PDF slides with no interactive elements. C. Long, uninterrupted text passages without visuals. D. Repetitive lecture recordings with no learner participation. 14. Which evaluation strategy best measures effective learning outcomes in anatomy instruction? A. Reflective journaling assessing attitudes toward ethical dissection practices. B. Multiple choice questions on anatomical terminology. C. Timed recall exercises for memorization of organs. D. True or false quizzes on structural identification. 15. When mentoring novice learners in physiology, what communication style promotes critical thinking? A. Using Socratic questioning to guide reasoning about homeostasis. B. Providing direct answers without explanation. C. Discouraging questions to maintain authority. Repeating the same content until memorized. 16. In ensuring regulatory compliance in physiology lab practices, what documentation is essential? A. Safety training records and material safety data sheet, MSDS logs. B. Informal verbal reminders without written records. C. Unverified student attendance notes. D. Reliance on memory for incident tracking. 17. Which adult learning method most effectively supports mastery of anatomical terminology? A. Collaborative peer teaching activities incorporating flashcards and clinical examples. B. Instructor-only lectures using dense terminology lists. C. Repetitive reading without practical usage. D. Assessments focusing solely on spelling accuracy. 18. During evaluation of physiology concepts, which question format best measures higher-order thinking? A. Case-based scenarios requiring analysis of physiological processes. B. Short recall questions about hormone names. C. Matching organs to body systems. D. Labeling diagrams without explanation. 19. What instructional design principle ensures inclusivity in anatomy and physiology curriculum development? A. Incorporating diverse learning modalities and accessibility tools. B. Delivering identical content regardless of learner background. C. Requiring advanced reading without support. D. Excluding non-traditional learners from lab sessions. 20. Which mentoring practice best supports learners' application of pathophysiology to real-world contexts? A. Encouraging learners to connect case studies with clinical decision-making. B. Focusing solely on theoretical content without application. C. Limiting mentoring to exam preparation. D. Discouraging learner reflections on clinical scenarios. 21. When assessing anatomical knowledge, which evaluation approach ensures fairness and reliability? A. Using standardized rubrics with clear scoring criteria. B. Grading based on instructor opinion alone. C. Ignoring inter-rater reliability in practical exams. D. Using inconsistent grading standards. 22. In an adult learning anatomy course, which strategy fosters motivation and self-efficacy? A. Allowing learners to set personal learning goals tied to anatomical competencies. B. Restricting all assignments to instructor-selected topics. C. Penalizing learners for self-directed study attempts. Using identical assessments for all learners regardless of goals. 23. When teaching cardiovascular physiology, what instructional activity best supports knowledge transfer? A. Simulating blood pressure measurement and interpreting results collaboratively. B. Requiring silent note taking during lectures. C. Assigning textbook readings without application. Showing videos with no guided discussion. 24. Which method of formative assessment best enhances ongoing learning in anatomy labs? A. Providing real-time verbal feedback during dissection exercises. B. Waiting until the end of the term to deliver feedback. C. Using only written tests without observation. D. Avoiding assessments during practice sessions. 25. Which principle of adult learning is most applicable when teaching about endocrine feedback mechanisms? A. Connecting physiological feedback loops to learners' own stress responses. B. Presenting endocrine terms without context. C. Avoiding examples to reduce discussion time. D. Focusing exclusively on memorization of hormone names. 26. When developing anatomy course objectives, what ensures proper curriculum alignment? A. Writing measurable outcomes linked to assessment criteria and instructional activities. B. Using vague objectives without measurement indicators. C. Creating objectives unrelated to anatomy topics. D. Omitting evaluation alignment altogether. 27. Which mentoring technique helps learners struggling with neural communication concepts? A. Encouraging analogies, comparing neuron firing to real-life communication systems. B. Repeating definitions without explanation. C. Avoiding visual aids to simplify learning. D. Discouraging learners from asking clarifying questions. 28. In assessing understanding of respiratory physiology, which evaluation promotes deeper reasoning? A. Asking learners to explain the impact of altitude on oxygen exchange. B. Testing only the names of lung lobes. C. Requiring memorization of respiratory structures without context. D. Using fill-in-the-blank quizzes on terminology.